Welcome to the AI Shift, a show looking at the seismic changes happening in healthcare with artificial intelligence at the epicenter. I'm your host, Tom Foley. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and for the future. And now, the AI Shift. Welcome. You're listening to the AI Shift, and I am your host, Tom Foley. We have a great guest on today, Dipak Patel. He is the CEO of Globo. Dipak, welcome to the program.
Thanks for having me, Tom. Really excited to be here.
So, Dipak, listen, healthcare is ever changing. Access is kind of that one of those key mantras. One would think, hey, just schedule an appointment. What's the big deal? But at the end of the day, 1 in 5 Americans speak an alternative language in their homes, and the barrier to care is somewhat based on language, the ability to communicate, the basic fundamentals. Tell us a little bit about yourself, and tell us a little bit about how Globo looks to address that gap.
Yeah, I don't think people recognize that there's that many people in the country that prefers to speak a language other than English, and I've dealt with it personally myself, which I'll talk about. So I'm the CEO of Globo. Been with Globo since 2021. Although Globo's been around for almost 20 years, we're considered the 4th largest healthcare interpretation company in the country. My background has always been in healthcare. Before this, I ran a medical coding company. I invested and helped run a bunch of revenue cycle companies, and I spent 15 years at Accenture in their healthcare practice, working for hospital systems, insurance companies, pharmaceutical companies. Bringing it back to why I'm passionate about this space and from a personal standpoint is I'm first generation, born and raised in beautiful New Jersey. My mom spoke English, but Hindi was her native tongue, and she was sick for almost 10 years. And I noticed how language interpretation or language services helped in that experience. There's times where she would not get an interpreter and it'd be a terrible experience. We'd leave the office and they'd ask to call my uncle back in India to figure out what's going on. There's times where she'd get a bad interpreter and my dad would argue with the interpreter in the middle of the session with the physician, saying, that's not what she said, that's not what he said. And then there were times where she got a great interpreter, and it completely changed the context of the discussion. It built trust, rapport between my mom and the doctor, and it just made a night and day difference. And so when I got into this space, it came from a personal background, understanding that there's a huge opportunity to improve the experience of patients, and as a result, it will improve the healthcare of these patients. And so you're right. I don't, a number of Americans in this country need interpretation and language services solutions. We're not meeting their needs by any means. There's a lot of things that we need to do better as a healthcare system to take care of that 20% of the population.
Outline a little bit more about those needs. There's, I would agree, educate the audience a little bit about what could healthcare do more of in terms of addressing this population that has an additional barrier to care because of language.
So Tom, the way I like to think about it is maybe think about your own healthcare experience as someone who speaks English and how frustrating it is from the beginning to the end. Everything from when you're trying to schedule a physician appointment, how hard it is to get a hold of someone, have a conversation with them saying, hey, I can't go at that time because I can't get someone to look out after my kids, or I can't take off from work, to when you actually get to the physician office or the hospital system, you're trying to navigate where is the actual office I'm trying to go to. You get there, you get a bunch of papers that you thought you filled out, and you have to fill it out again. You're trying to figure out what all these questions mean, all under this significant weight that you're carrying, depending on why you want to see the doctor. Then you're extremely nervous and you get to see the doctor. And you see the doctor for what feels like 90 seconds, and you think it's the most important session in the world. And they're throwing things at you left and right, and you're trying to grasp, what did that person mean? Again, think about this when you understand English. Then they give you a set of papers. They tell you, I want to do these things. You get home and you're like, well, what did they mean? What does that mean? I got to pick up some medication. I go to the pharmacist. I get there. You get a bunch of medications and you're like, when should I take this? And the pharmacist is trying to also help you what you should do, when should you do this. Then at some point, you might get some tests and they call you up for some test results. They call you over the phone. They tell you these things. And then they tell you, hey, the doctor will call you and explain what this is if you're lucky enough to maybe not even have a nurse give you that information. And then you finally get a bill. And the bill makes 0 cents at all in English. Now imagine you were in Vietnam and you didn't speak Vietnamese and you had to go through that type of experience. That's the type of experience that 20% of this population face day to day. That's the frustration that the patient feels. Now think about it from a doctor's standpoint. And right at the end of the day, a doctor, they mean well. They just want to figure out what's going on and they want to help you fix whatever that is. But the first they need to understand what's going on. And so imagine a world where you're a doctor and someone comes in and they barely speak English. And you're trying to figure out, okay, well, they filled out all this paperwork in advance. I don't know what this answer was. This doesn't make sense. What's going on here? By the way, they were supposed to come 2 weeks ago, but they missed that appointment for whatever reason. And now they're in the office and you're trying to communicate with them, trying to really figure out what's going on, and you can barely understand what they're saying. You think you know what's going on. Appointment that should have probably taken 20 minutes is now 40 minutes. You send them home saying you want them to do these three things and pick up this medication and have these follow-ups and come back to see me a month from now. And you're like, that's not happening because they're going to go home and they're going to experience the same failure, the same barriers that we explain. So just to bring it to life, I always say, imagine what your experience is like today when you understand and speak English, and imagine how hard it is if you don't understand English.
Yeah, and you're calling out, I'd say the obvious, but not necessarily how these types of services are typically deployed, right? Typically, you got to get into the telehealth visit, or you got to get into the doctor's office, and then the interpreter comes in. But I got to get there first, and that
Right.
pathway, that you just outlined is the challenge of the day. And
That's correct.
sometimes, and that's ultimately the inhibitor, is that I just don't want to go through that struggle of getting into the visit, right? I know once I get there, I'll be okay, but so often people shake their head, yeah, when you talk to them, do this, do that, yeah, I'll do it, right? So they're acknowledging it, but it's a fake acknowledgement because they're just maybe I would argue, maybe embarrassed or lacks confidence in the fact that, hey, I don't speak your language, but I'll just acknowledge what you said, right?
Or they can't have the conversation. So someone's trying to call up, schedule an appointment. They can't simply say, here, come in next Tuesday or come in December 13th. They can't have the dialogue to say, I can't get off from work or the bus doesn't run at that time. So oftentimes, to your point, they want to be really nice and say, yes, yes, yes. And then what happens? The doctor's waiting and no one shows up, which research shows there's a higher percentage of a no-show with a limited English proficient patient where you aren't providing interpretation services for that exact reason.
So walk me through Globo.
Yeah.
I totally get the problem, and my grandparents came over and they spoke Italian, right? And so very similar scenario. I remember a couple things when I was a kid, but nonetheless, language is the barrier. As a matter of fact, it wasn't healthcare. Just a quick aside, had workers in our house. We were doing home repairs due to the hurricanes down here in Florida, and they all had earbuds in. One spoke Spanish, the other one only spoke English, and the earbuds were translating in real time. Right, so they could have. I was like, he spoke Spanish. I know you don't speak Spanish. How did you know what he said? Right. So, but the point is that language is a barrier, and so tell me a little bit about what Globo is doing specifically on how to close that gap so we can so everybody can have equal access to care.
Yeah, we'd love to. And then maybe let's come back to that example and how technology will impact interpretation. So we are the fourth largest healthcare interpretation company in the country. We provide a full suite of interpretation. So everything from in-person interpreters, someone in the room to do the interpretation, to you access your interpreter over the phone or through video. And then we were actually the first company out there to launch an AI healthcare specific interpreter, which we can talk more about. We also provide translation. So think about translation of everything from marketing materials letting people know they need to come in for their vaccines or wellness visits, to discharge instructions. When they leave, okay, right, here's what you need to do. And then the third thing I would say, which is really important, is fluency testing. There are clinicians and administrative people out there that believe, I took 4 years of high school Spanish. I am qualified to talk to a patient. You have to be fluent, right, in a language to talk. And that's really important. The government, the Joint Commission looks at that to make sure, okay, you had someone in that didn't speak English. Who spoke to that person? Oh, Dr.
Right.
Smith. Okay, prove to me that Dr. Smith was fluent. So we'll work with organizations to offer all those three scenarios in the hopes, at the end of the day, our major goal, Tom, is to fill those gaps from a patient journey standpoint, to make sure that they're just not receiving interpretation when they're seeing the doctor, but they're seeing it during every step of the patient journey, from when they're being marketed to when they get their bill at the end.
And how is that being received by both the health systems and I'll even add the payer themselves? Because to your point earlier, I got an EOB. It's in English, right? So somebody's paying something bill,
Yeah.
but I hate to joke like it, but there's a larger system out there other than just the doctor's office. So
Yeah.
tell us a little bit more about how they're accepting this.
Yeah. All healthcare entities, whether it be a provider system or a payer, understand the value of language services. They do get it. It's kind of intuitive. We supported almost 400 languages and dialects out there. It's a large part of this beautiful country. People speak a lot of different languages. If you are a healthcare provider and you receive any sort of government funding, you are required to provide language services if the patient asks. Now, if you talk to a provider or clinician and say, if you weren't forced to do this, would you do this? They would do it. They understand that if I can't communicate with my patient, then I can't do my job. The whole is the experience isn't very good for the clinician in terms of how to access and get those interpreters. And there's gaps in the entire patient care, like I said before. We're not doing it during every step in the journey. And for some of the steps, it's primarily being focused on what I'd call the popular languages, right? Spanish, Mandarin. It's not being focused on for languages like Twi or Dari or Pashto, what have you.
Mm.
From a payer standpoint, same thing. They understand the value of language services. They want their members to understand what kind of benefits they have. They want their members to understand what was covered and what's not. I think the unfortunate part is language services, however, is just not at the seat of the table from a strategic lens. So that when they're making investment decisions, for example, we need to update our website. There's no one in there saying, well, do we also need to have in other languages, right? The 100 languages that we actually interact or people interact with. Or when we do provide an EOB, do we actually need to translate that in different languages? How many languages? It's more of an afterthought, to be honest, than
Yeah.
thinking right up front.
And I would imagine that extends to the idea that to your point, if you're receiving services through government, like Medicare and Medicaid as an example, so therefore certified EHR, interoperability, access to a patient portal, therefore access to your charts, the ability to translate that chart, which is probably in English, to whatever language. Is that a focus of yours, is to be able to translate that into the local language, if you will?
Yes. So we just translation is really important. It's behind interpretation in terms of just healthcare companies understanding we need to translate different, not just discharge instructions, but when the physician is emailing a patient or what have you. And a lot of that, to your point, is through the EMR. And so we have an integration with Epic that allows us to receive any type of information that the doctor is trying to send to the patient, and then we can do the translation using machine learning. You need a human to also review it, depending on the type of information that you're trying to deliver, and then it's automatically pushed back into the medical record for them to send. Again, this is all fairly new, and most hospital systems don't take advantage of it. Because again, I don't think language services always has a seat at the table in terms of, hey, as we
Yeah.
think about the workflow the clinician needs to go to, have we thought about it through the lens of the again, 20% of our patient population that doesn't speak English.
Yeah. Yeah, it seems, again, the number's too high to ignore when you have, 20% of Americans that need that language assistance. It's just, like I said, it's way too high to ignore at this point.
Correct. And
It could be part.
we have some customers that roughly 65-70% of their population, because of where they're located geographically, needs language services. And then you have other hospital systems that might be in different areas where it's 5%. But that 5% could still drive a lot of distraction in terms of more likely to be readmitted into their ER instead of the physician spending 10 minutes or spending an hour, right? So that 5% can still cause a lot of effort and angst amongst the hospital system.
Interesting. Tell me a little bit more about the value side, the measured improvements, outcomes relative to language services.
So there's been a ton of research that just shows if you aren't providing language services to patients, more likely to be readmitted into the ER. Their length of stay is higher because you think about it, Tom, someone's coming in and you're trying to figure out what's going on. If you can't communicate with them, you're going to run the gambit in terms of types of tests. And so
Yeah.
instead of maybe being, a 2-day length of stay at the hospital, it turns into a 3 or 4 day length of stay. So there's research that has proven that out tremendously, less likely, as we talked about, to show up, to the doctor's appointment. But even just quality from the standpoint of interpretation, that's what we recognize was missing from this industry. And so whenever a company is providing interpretation services to a hospital system, Tom, it's the hospital system is relying on the actual vendor to tell them was the quality good or not. Unless the physician happens to speak that language and they're like, that interpreter didn't say things accurately. Or maybe the patient was brave enough to raise their hand. What's been missing from this industry is a standard way of assessing quality for every single call. And that's one of the things we've led the charge with. We're the only company, as we know, that you will understand the quality of every single call using technology. That way you can get a sense from a compliance standpoint. Instead of saying right once, they actually said 11, right? That's the example I like to give. Once,
Hmm.
ONCE, that's once, that means 11 in Spanish, right? You can catch some little things that might not normally be caught and leads to some pretty significant issues down the road. The other reason why quality is so important, and you talked about this earlier, is the use of technology or AI to provide interpretation services. I get the question all the time, which I'm sure is going to be one of your questions. Do you think AI can replace human interpreters? And I think that's the wrong question. I don't think it's an if, it's a when, right? I mean, 400 years from now, I think AI is going to be able to do language interpretation. The question is it going to be able to do it 3 years, 5 years now? And what elements of language interpretation can it do? And the analog I like to give is self-driving cars. There used to be a debate. Computers could never drive cars as a human. Well, what does that mean? A perfect human driver? There's no such thing as a perfect human driver. There's really good human drivers. There's really bad human drivers. The question is, can it do acceptable? And what is that definition of acceptable for interpretation? That is missing in this industry. And so we've been leading the charge to say, okay, this is how you assess accuracy. This is how you assess quality. You need to do it for every call. Here's the baseline of what acceptable looks like. And then you can measure AI on top of that to determine whether or not AI is good enough as a human interpreter for certain cases.
Yeah, I totally agree. I think AI is being held to a much different standard than even our own healthcare system today, right?
Yes.
We know, I don't want to get off too far off topic here, but we know that the data in and of itself within an EHR is not as clean as it should be. And we know that there are flaws in the interoperability side of the equation where, there's going to be mismatching of data. I was speaking to a major healthcare system and they told us that, 30% of their data was questionable. 30%. That leads to a
Crazy.
lot of errors. Now, if
Yes.
AI, so and there's a whole bunch of so the 240,000 medical errors committed every year due to insufficient data or errors in the data says a lot about the quality of an EHR or the health system in and of itself. That said, why AI is being held to perfection is a question that needs to be challenged because sometimes people just don't like something new.
Yeah.
Change doesn't happen without change.
Correct.
and you got to be willing to adapt to it. And because there's no, at least in my experience with AI, I haven't seen anybody lose their job because of AI in healthcare. There's too much on one side of not enough providers and patients, and too many patients needing more services because they're sicker today than they were yesterday.
Yeah.
Right. So AI is not going to displace anyone. It's going to be that tool that has to be embraced in order to provide equal to or better than care than they're getting today. Because right
That's
now
right.
we are very diluted in spreading our resources way too thin, considering the overall demand.
Completely agree with everything you said, Tom. And maybe to bring it to language services, we talked about that patient journey.
Yes.
There's gaps that aren't happening today, meaning interpretation should be happening and it's not. Translation should be happening and it's not. So I go back to my mom. I can tell you countless times she'd show up at a hospital and would try and navigate where to go. And for whatever reason, she didn't feel, whenever she's really stressed, she used to speak Hindi, not English. And so she'd be trying to talk to people. That's a great example where someone shows up, doesn't speak English or is stressed and speaks their native tongue. You could use AI for. It doesn't have to be 100% perfect. It has to be go down that hallway or do this. Or talking to potentially a nutritionist about food, right? That's normally you're not using interpretation,
Right.
which is interesting because that's where you probably need interpretation. Part of that is just the difficulty in terms of getting an in-person interpreter over the phone or video. These are great use cases where you could use AI. The problem and what we think about a lot because we've been studying this for 2 years AI seems to make sense for non-clinical administrative tasks right now in terms of how good it is for certain languages, not all 400 languages and dialects we supported, right? The tricky part is what happens when that conversation turns from administrative nature to clinical nature. So you're talking to a nutritionist and suddenly you get into the realm of mental health because maybe that's impacting why that person's eating or not. At that point, you hit clinical and you want and you should have a human interpreter there to make sure they're not just interpreting correctly, they have empathy, they're making sure they're asking clarifying questions to really understand what the doctor is saying. They're serving as an advocate for the patient. So the
Yeah.
reason I say this is it's a little bit more nuanced as you think about the patient journey. And one of the things that we've figured out is how do we not only deploy our AI solution in administrative solutions, but how do we put in the right checks so that when you need a human interpreter will come.
Yeah, I couldn't agree more. It's the diversity of the engagement, and you apply different segments of your solution to best support that patient at the appropriate intersection. So we have 3 minutes left, and so tell me, in closing, why Globo. Talk to the CEO of that hospital system. Talk to that CEO of a payer. The again, I don't want it to be a sales pitch, but it is the whole language interpretation element is so critical to improving overall access to care that only someone like you could explain why it's needed.
Yeah. Maybe put Globo aside, just in terms of what I would love to happen in healthcare. I would love every healthcare provider across the country to invest in how do we provide professional language access during every step of the patient journey, not just when they're with the doctor, but when they're trying to scheduling, billing, mental health, discharge instructions. That is what we want to achieve. That's what I would like to see across the organization. Why I think Globo is one of the best companies to take you there is you can't do that with the current model and structure. As I mentioned, the only innovation that happened was instead of in-person interpreters, now you have something over the phone. We've been pushing the boundary. We'll continue to push the boundaries with our customers on how do you innovate and provide language access in a way that makes not just the patient experience better, but the clinical experience better. So table stakes, EMR integration, we do that. Other vendors do that well, but that's table stakes. There's a number of hospital systems that haven't even done that. Introducing AI to fill those quality gaps, very important. Making sure that you have some sort of live quality tool and you set the expectation with whoever you're working for. I want to understand the quality of every single call. providing solutions that leverage and make your own interpreters. So a lot of hospital systems will actually employ their own interpreters. How do you make them more valuable? Doing things to level up your interpreter so that when they're actually interpreting, how do you do things like give them nudges to say, hey, before you interpret, you want to ask that doctor, what did they mean? Because what they said can mean two different things. We got to interpret the right meaning. So there's a lot of new things that we are pushing out to the market, introducing to the market with the ultimate goal, how do you provide language access during every step in the country? And that would be sort of my pitch to every CEO, healthcare provider out there, and ending with, if you do this, there's real financial outcomes. It's reduction in readmissions, or it's reduction in length of stay, but probably one of the most important things, it makes your clinicians more efficient and more effective. They spend less time, they are happier, et cetera, et cetera. So that would be my pitch, Tom.
Yeah, nothing like investing in technology that has real economic return. And economic returns, certainly, right? We all want that, but I'm a patient. I feel better. I have a more stable life, if you will. I'm not spending my time in the emergency room or in the hospital because of something so simple I shouldn't say so simple, but simple as language interpretation. So Dipak Patel, CEO of Globo, great talking to you. Please, let's do this again. And I look forward to following you guys as you go along your journey. I believe, what is it, helloglobo.com?
Yeah, helloglobo.com. Yes, correct.
Is your website, and certainly Dipak Patel can be found on LinkedIn as well.
Appreciate it. Thank you.
Thank you. Thanks for listening. If you missed any part of today's episode, you could tune in at the same time, 11 a.m. or 7 p.m. Eastern throughout the week. Be sure to check out the program page on healthcarenowradio.com, and remember to connect or follow me on LinkedIn, X, formerly Twitter, @FoleyTom, and follow the show's hashtag, The AI Shift. I'm Tom Foley. Until the next shift.